Hey, welcome to The Explainer. So today we're diving into the pretty wild world of psychopharmacology. Basically, the science of how a tiny, tiny pill can have such a profound effect on your mind. We're going to unpack the risks, the rewards, and the incredible chemistry that makes it all happen. It really all boils down to this one central, fascinating question. How can something so small create such a massive change in our mood, our thoughts, even our perception of reality? Well, the answer lies in understanding the brain's own native language. And that language? It's all about chemistry. So before we can even begin to talk about the drugs, we have to talk about the brain's natural communication network and the tiny little molecules that run the entire show. At the very heart of this system is the neurotransmitter. The easiest way to think about these is like tiny chemical text messages. They're fired from one nerve cell to the next, and they carry instructions that dictate, and I mean literally, everything you think, feel, and do. And here's the amazing part. Your entire mental state right now comes down to this constant, delicate balancing act. Some of these chemical messages are what we call excitatory. They hit the gas pedal and yell, go, and others are inhibitory. They pump the brakes and say, stop. And the brain's main stop signal, its master of calm, is a neurotransmitter called GABA. It's the perfect analogy, really. GABA literally acts as the brakes for your brain. So in states of high anxiety, it's like your engine is racing, but there's just not enough brake pressure. That's why a lot of anti-anxiety meds work simply by helping these natural brakes do their job more effectively. So if the brain is this super complex chemical system, then these medications are like sophisticated tools designed to hack that system. They don't usually add brand new chemicals. Instead, they manipulate the ones that are already there doing their thing. Okay, let's take one of the most common antidepressants, the SSRIs. You've probably heard of them. Normally, when your brain releases serotonin to send a mood-regulating message, it's quickly recycled, or as one source colorfully put it, resucked back into the cell that sent it. Well, SSRIs work by physically blocking that recycling vacuum. And the result? More serotonin is just left floating around between the cells, which gives it more time to deliver its calming, mood-lifting message. Now, antipsychotics use a totally different strategy, blocking. The first-generation drugs were kind of like a sledgehammer. They powerfully blocked receptors for a neurotransmitter called dopamine. And this was great for what we call positive symptoms, things that are added to a person's experience like hallucinations. But that sledgehammer approach often caused really severe movement-related side effects. The newer second-generation drugs are a bit more refined. By blocking both dopamine and serotonin receptors, they can also help with negative symptoms, things that are taken away like motivation or feeling emotion. And they do it with a much lower risk of those awful movement issues. But let's be clear, hacking the brain's code is a high-stakes game. While these medications can be absolutely life-saving, they are also incredibly powerful and, potentially dangerous tools. The line between helping and harming can be razor thin. And you know what? Nothing illustrates this better than the mood stabilizer lithium. This number you see on the screen, that's its therapeutic range in the blood. If the level falls below 0.6, the drug might not work at all. But if it creeps up much past 1.2, it starts to become toxic. It is a constant, daily tightrope walk between being effective and being dangerous. And the risks, they get incredibly specific. For the antipsychotic clozapine, the big danger is a catastrophic drop in your infection-fighting white blood cells. For lamotrigine, a mood stabilizer, it's a rare but potentially fatal rash. And for an older class of antidepressants called MAOIs, believe it or not, the danger can be hidden right on your dinner plate. This is famously known as the cheese effect, and it's a wild one. When you're on an MAOI, an amino acid called tyramine, which is found in all kinds of delicious aged and fermented foods, can't be broken down properly. This causes a massive, dangerous spike in blood pressure called a hypertensive crisis. I mean, a simple charcuterie board with some aged cheese, salami, and a glass of red wine could literally become a medical emergency. Okay, so beyond those immediate life-threatening risks, there are other really serious side effects that can develop over time. particularly the ones that hijack the body's movement control systems. So, what are we talking about? This group of side effects, most common with those older antipsychotics, are called extrapyramidal symptoms, or just EPS for short. They happen when the medication's dopamine blocking effect kind of spills over into the parts of the brain that control your movement. The most dramatic and honestly the most terrifying form of EPS is something called acute dystonia. This is not just a little twitch. We're talking about a powerful, sustained muscle contraction. A person's neck can get locked to one side, or their eyes can get locked staring upwards. It's a true medical emergency that requires an immediate injection to reverse it. Now, akathisia, this one is different. It's not a muscle spasm. It's this deep, maddening internal feeling of restlessness. People describe it as wanting to jump out of their own skin. It's so deeply distressing that it's a major reason people stop taking their medication. And then there's the one that providers, well, they fear this one the most, tardive dyskinesia. Tardive just means it shows up late. This can appear months or even years into treatment, causing these involuntary movements like chewing, lip smacking, or the tongue thrusting out. And the most devastating part? Even if you stop the medication, it might never go away. All right, so besides movement problems, there's another major danger. Just pushing the system way too hard. You can actually have too much of a good thing, leading to a complete system overload that can absolutely be fatal. Two of the most feared system overloads are serotonin syndrome and something called neuroleptic malignant syndrome, or NMS. Serotonin syndrome is basically a flood of way too much serotonin, often from mixing medications, and it can lead to agitation, confusion, even seizures. NMS is a rare but often lethal reaction to antipsychotics, and while they can look similar, the big signs of NMS are a crazy high fever and what they call lead pipe muscle rigidity. Both are absolute drop-everything medical emergencies. So, with all of these potential risks, you might be asking, how in the world do we navigate this safely? Well, this brings us to the most important part of the entire equation, the patient. Safe treatment is an active partnership for sure. Okay, if you remember only one single thing from our entire chat today, please make it this. Never, ever stop these medications abruptly. Your brain chemistry has literally adapted to the presence of the drug. Ripping it away suddenly can throw the whole system into absolute chaos. This chemical chaos has a name. It's called discontinuation syndrome. It can feel like a really bad flu, but it comes with these bizarre neurological symptoms like brain zaps, a feeling people often describe as little electric shocks going off in their head. This is exactly why you must always work with your provider to taper or decrease the dose very, very slowly over time. And this brings us to your safety checklist, the active role you can and should play in your own treatment. First, know the specific key risks of your medication. Second, report any new symptom to your provider right away, especially something like a rash or a fever. Third, never ever change your dose on your own. For a drug like lithium, keeping your salt and water intake stable is absolutely vital. And finally, you have to discuss all other substances with your provider, and that includes everything from cold medicine to herbal supplements. Because in the end, right, it's not just about taking a pill. The real goal is about trying to restore a complex and incredibly delicate chemical balance. These medications are just one tool in that process. And the real question that remains is how can we be an informed, a vigilant, and an active partner in safely finding that equilibrium?